He said that the state recorded 15 cases, including 2 deaths. 145 contacts of the confirmed cases have been traced and have been monitored. We received 9 alerts from the public. 7 were investigated and none is worthy of following up, while 2 are still being investigated, Kwayabura said. He also recommended the sacrifice and the level of compliance shown by the public in the second day of the lockdown, saying the committee was considering modifying the lockdown in the spirit of Ramadan. Governor Amadou Fintri of Adamawa State has locked down the state for 2 weeks. This is the second lockdown the governor would declare since the outbreak of COVID-19 in Nigeria. The fresh lockdown coming 2 days after the state index case of COVID-19 was confirmed is clearly to prevent the virus from spreading. A statement released Friday by Governor Fintri, Director General in charge of Media and Communication, Solomon, said the Adamawa State government has imposed a lockdown throughout the state for another period of 14 days with effect from midnight of Friday, April 24th, 2020 and to end on Friday midnight of 8th May 2020. Now moving on to Kwara State. The Kwara government confirms new cases of COVID-19 in the state. The Kwara State government has confirmed that it has recorded 2 new cases of COVID-19 in the state. The state government on its Twitter page said the total number of COVID-19 cases is now 11. The Kwara government tweeted 2 new cases of COVID-19 confirmed. Total tests done is 278, while total confirmed cases is 11. Number of active cases is 9, while number of discharge is 2. Number of negative tests is 187. Number of pending tests is 80, while we have no death in Kwara State. On the 24th of April 2020, 114 new confirmed cases and 1 new death were recorded in Nigeria. 1 new state, Zamfara, has reported a confirmed case in the last 24 hours. Till date, 1,095 cases have been confirmed. 208 cases have been discharged and 32 deaths have been recorded in 27 states and the Federal Capital Territory. The 114 new cases are reported from 9 states: Lagos 80, Gombe 21, FCT 5, Zamfara 2, Edo 2, Ogun 1, Oyo 1, and Kaduna 1, Sokoto also 1. Now quickly taking you through the case summary in Nigeria as at April 24, 2020. As the case summary in Nigeria as at April 24, 2020. The total samples tested in Nigeria is 1,061, while the total confirmed cases in Nigeria is 1,095. Also, the discharge is 208, while we have 32 deaths in Nigeria presently. Now the state affected, number of cases confirmed, number of active cases, number of discharge, number of deaths. And don't forget that Lagos State is the number 1 state topping the list in Nigeria of COVID-19 in Nigeria. Lagos State has 657 confirmed cases in the state, while 525 active cases in the state. 116 discharged patients in the state, while we have 16 deaths in Lagos State. And also moving on to FCT Abuja, 138 confirmed cases in Abuja. While 100 active cases in Abuja, 35 discharged patients in Abuja, and 3 deaths. Now moving on to Kano State. In Kano State, 73 confirmed cases in Kano State, and also 72 active cases in Kano. No discharge patients, but we have 1 death in Kano State. And also moving on to Ogun State, 35 confirmed cases in Ogun State, while we have 29 active cases in Ogun, and 5 patients has been discharged, 1 death in Ogun State. Moving on to Castina, 21 confirmed cases in Castina, and also 20 active cases in Castina. No discharged patients in Castina, but we have 1 death. Moving on to Osun here. Number of confirmed cases in Osun is 20, while 2 active cases in Osun, and also 18 patients has been discharged in Osun. While no death, we have no death in Osun State here, according to NCDC. And also moving on to Oyo State, 18 confirmed cases in Oyo, 12 active cases, 5 patients has been discharged, while we have 1 death in Oyo State. Moving on to Edo, 19 confirmed cases in Edo State, 9 active cases in Edo, while 7 patients has been discharged, and also 3 deaths in Edo State. I'm moving on to Borno. We have 12 confirmed cases in Borno State, 10 active cases in Borno. No discharge patients, but we have 2 deaths in Borno State. And moving on to Kwara State, 11 confirmed patients in Kwara, 9 active cases in Kwara State, 2 patients has been discharged, no death in Kwara State. Moving on to Akwa Ibom, 11 confirmed cases in Akwa Ibom State, 7 active cases still in Akwa Ibom, while 3 patients has been discharged, but there is 1 death in Akwa Ibom State. Alright, let's join Michael all the way from Akwa Ibom.
My name is Michael Celeste, my correspondent reporting from Iket in Akwa Ibom State on the issue of coronavirus COVID-19. So far, Akwa Ibom State has recorded 9 confirmed cases with 3 discharged and 1 dead. To combat the spread of this dangerous and deadly disease, Akwa Ibom State has extended the lockdown officially scheduled to end on April 2020. The lockdown is now expected to last at least until the 2nd of May. Furthermore, government has put in place adequate and functional medical facilities and personnel to help combat the spread of this dangerous and dreaded disease. Seminars, radio programs, and other educative programs are also ongoing, with each program aimed on educating citizens on how to prevent and combat this dangerous disease. Governments are also doing all they can to make life comfortable to all indigents. Markets and food shops are allowed with restricted distance and preventive rules to be fully adhered to. Food items, cash, and other benefits are also being distributed by government and other well-to-do citizens to the less privileged to make life comfortable. The state governor, Dikeni Emmanuel Udom, has encouraged all citizens to stay prayerful and hope for a permanent cure. My name is Michael Celeste, my correspondent reporting from Iket in Akwa Ibom State on the issue of coronavirus COVID-19.
Thanks so much, Michael from Akwa Ibom. Let's continue. Kaduna. Confirmed the cases in Kaduna State. 6 active cases in Kaduna presently, while 4 patients has been discharged. No death in Kaduna State. In Gombe, we have 30 confirmed cases in Gombe. Also 30 active cases presently in Gombe State. No discharged patients and no death in Gombe State. Moving on to Bauchi, 8 confirmed the cases in Bauchi. 3 active cases, 5 patients has been discharged and no death in Bauchi. Moving on to Delta State, 6 confirmed the cases in Delta State. And also we have 5 active cases in Delta. No discharge, but 1 death in Delta State. Moving on to Ekiti. There is still 4 confirmed cases in Ekiti State. 1 active, 2 discharge, 1 death in Ekiti State. And also in Ondo, 3 confirmed the cases in Ondo. 1 active, 1 discharge, 1 death. Moving on to Abia State, 2 confirmed, 2 active, no discharge, no death in Abia State. Moving on to Enugu State. In Enugu, 2 confirmed the cases in Enugu State. No active, 2 has been discharged, and no death in Enugu State. Moving on to Rivers, 3 confirmed the cases in River State. No active, 2 has been discharged, 1 death in River State. Moving on to Niger, 2 confirmed, 2 active, no discharge, no death. Moving on to Jigawa State, 2 confirmed, 2 active, no discharge, no death. And moving on to Benue State, 1 active, 1 confirmed, no discharge, no death in Benue State. And moving on to Anambra State, 1 confirmed the case in Anambra, 1 active, no discharge patient, no death. Moving on to Sokoto State, we have 2 confirmed cases in Sokoto, 2 active cases, no discharge patients yet, and no death. These also apply to Zamfara State, 2 confirmed, 2 active, no discharge, no death in Zamfara State. In Adamawa State and Plateau State, we have 1 confirmed, 1 active, no discharge patients yet, and no death in Adamawa State and Plateau State. Now this now brings the total confirmed cases in Nigeria to 1,095, while the total active cases in Nigeria is 855, while we have 208 discharge patients in Nigeria, and also we have 32 deaths in Nigeria presently as we speak. Alright, this is where I will drop the curtain on today's COVID-19 update coming through from the stables of Timsat 94.1 FM. Alright, before I leave on today's COVID-19 update, quickly I want to take you through on a journey the Presidential Task Force briefing yesterday. Stay tuned and enjoy yourself.
You're welcome. We shall maintain our format. The SGF will make his remarks We'll take the technical inputs from the Minister of Health, the DG NCDC, the National Coordinator, before we take the questions. If there are other interventions from ministers, we shall bring them to the podium to present their updates. I now invite the Secretary to Government to please make his remarks. SGF, sir.
Members of the Presidential Task Force on COVID-19, let me also specially welcome the Honorable Minister of State, Labor and Employment, and the President of the Nigeria Labour Congress and his officials, distinguished ladies and gentlemen, gentlemen of the press. I welcome you all to the briefing for Friday, 24th April 2020. I begin this briefing for today by saying Ramadan Kareem to all our Muslim brothers and sisters nationwide. This is a season of supplication, and I pray that Almighty shall accept all our supplications, cleanse our land, and show mercy upon his people. Yesterday, the ECOWAS heads of state held a summit via video conferencing to chart a common course for the sub-region on COVID-19. The summit was concerned about the negative social, economic, financial, and human security impact of COVID-19 on all ECOWAS member states, as well as the serious threat posed to the regional integration process and regional peace and security agenda. I'm pleased to inform you that in consideration of the need to ensure high-level coordination of all the regional efforts to contain the pandemic, the summit appointed His Excellency Muhammad Buhari, President, Federal Republic of Nigeria, as champion to coordinate the COVID-19 response and eradication process in the ECOWAS sub-region. This is a monumental recognition for the leadership role of our President and an endorsement of the direction we are headed in our national response. The implication of this assignment is that the PTF must now factor the West African sub-region into its plans and activities to support Mr. President in his new role. I must add that the summit also set up ministerial coordination committees on health, finance, and transportation to coordinate regional efforts under the supervision of the champion. Today, the welfare of our frontline heroes, the health workers, came to the front burner. I'm pleased to inform you that the Federal Ministry of Health, working in conjunction with the MDAs and the health sector professional bodies, have signed an MOU for various allowances and other incentives. The full details will be unveiled to you by the Honorable Minister of Health very soon. I am, however, pleased to inform you that in addition to what the federal government is doing, the insurance industry has responded massively to the call for support. The Presidential Task Force has received a life insurance cover to all frontline workers on COVID-19 for a maximum of 5,000 health workers who are employed to fight against the COVID-19 pandemic. The premium in the sum of 112,500,000 for cover has been fully paid by the Nigerian insurance industry in line with the principle of no premium, no cover. The PTF wishes to thank the insurance industry immensely and calls on other sectors of the economy to rise up to support the efforts to fight COVID-19. I also call on our frontline health workers to double their efforts, just as we want to assure them of our determination to protect them. I informed you earlier in the week that the PTF has embarked on the assessment of the readiness of 9 states. These visits have been quite informative, and we have, as a consequence, strengthened our collaboration with states. The Presidential Task Force will be fine-tuning the directions and advisories in order to effectively guide the states and for uniformity of approach. I use this opportunity to once more commend the governments of all states visited for providing leadership and resources in their preparations. I also wish to use this opportunity to restate that food security and self-sufficiency remain important to our national life. I therefore urge all our farmers to begin to prepare for their return to their farms as the planting season is here. The Federal Ministry of Agriculture has put in place arrangements for access to farm inputs, extension, and other services. The Presidential Task Force continues to work assiduously towards presenting a report to Mr. President after considering all critical factors. Let me state that these are unusual times. We are in uncharted territories, and we need to forge ahead. As we work out our models, we also draw lessons from other jurisdictions that have had experiences to share. We shall, however, continue to pursue the strategy of aggressive testing, detection, isolation, contact tracing, treatment, and care. Finally, let me repeat my appeal to all Nigerians to continue to comply with all advisories. These are still the most efficient measures that can help us manage the ravaging virus. I now invite the Honorable Minister of Health to present his update and to most sincerely thank you for listening. Thank you.
The Secretary to the Government of the Federation, Honorable Ministers here present, the Leader of Labour, Directors General, ladies and gentlemen of the press. Again, what I will say will reinforce much of what the Secretary to the Government has already put down. While 31 deaths have sadly been recorded. Again, the high number of new cases is due to ongoing community transmission and also the very active and accelerated case search going on. From our test statistics, most affected age group among the positives is the age group between 31 and 40 years, while the highest COVID-19 fatality rate is among the older generation above 50 years of age. We have now deployed COVID-19 starter packs to all tertiary health institutions and federal medical centers to complement what was earlier sent to each state. The starter packs consist of medical consumables and disposables to ensure that our frontline healthcare workers are protected, and also that there is synergy and collaboration between federal tertiary institutions and the host state health network. The COVID-19 capable National Laboratory Network, led by NCDC, has capacity to test over 1,500 samples per day in at least 13 laboratories, but the present utilization rate is barely 50%, since we averagely test about 600 samples per day, being the samples received at the centers. Efforts are on to increase the number of functional laboratories in the country. However, we need to meanwhile improve surveillance, sample collection strategy, and transport logistics to laboratories, and also reduce the turnaround time for tests. In our strategy, testing positive is followed by isolation and treatment as needed. Those who require no treatment still need to be in isolation in the interest of the public and their household. We urge all persons who have tested positive to comply, and for citizens to remember that anyone who has tested positive is not only just a private patient, but a patient of general interest. The COVID-19 virus has long since been declared a public health emergency of international concern. I wish to use this opportunity to applaud our frontline health workers again in the COVID-19 pandemic. Salute your courage and patriotism, but I urge you to protect yourselves as prescribed and use your personal protective equipment judiciously. Do not attempt to treat COVID-19 patients without using adequate PPE, or if your institution is not accredited to do so. This is important because we need to keep health workers safe at such a time and cannot afford the numbers who test positive to COVID-19 and have to go into isolation. Remain vigilant in the line of duty and maintain a high index of suspicion for this infection. I wish to appeal to all citizens to take the advisories that we give here daily and also repeat every time. Take these advisories seriously and adhere to the hand and respiratory hygiene as well as the social distancing directives. The use of a cloth mask or face covering when you leave your residence is recommended, as is the injunction to avoid mass gatherings and non-essential travels. I wish to restate the advisory given yesterday to reduce risk of community transmission by reducing all non-essential travel, especially long-distance travel. This will help to reduce the risk of carrying the virus from one state to the other. Today, I want to join the rest of the world to commemorate World Immunization Day, World Immunization Week. The theme for this year is Vaccines Work for All, and is dedicated to promoting the use of vaccines to protect people of all ages against diseases and death. While waiting for the vaccine for COVID-19, let us collectively adhere to all public health advisories. Finally, I emphasize again that to defeat the spread of COVID-19 requires collective and individual efforts. If you suspect you have been exposed to COVID-19 or anyone around you has been, call the toll-free NCDC numbers and the emergency number of 112 and 0800-97000010. Resources and real-time information on COVID-19 can be found in the social media handles of Federal Ministry of Health, the NCDC, the Federal Ministry of Health website, and NCDC microsite. Please stay home, stay safe, take care of yourself, take care of your family, take precautions.
So, gentlemen and ladies of the press, Chair, distinguished members of the Presidential Task Force. Firstly, I'll join the Chair and the Honorable Minister by wishing all my Muslim brothers and sisters Ramadan Kareem. So, COVID-19 has changed the way we live our lives in many ways. But one thing it hasn't been able to do is knock out our spirit as Nigerians. So I'd like to start today by really thanking everyone for your continued sacrifice on this journey, and your continued cooperation with the lockdown as advised, instituted by Mr. President and many other governors across the country. As we traveled around the country over the last 4 days, we could really see how difficult it has been and how hard Nigerians have been trying to do their very best. We know it's a difficult journey, but we also know that we will eventually exit this stage and we start our normal lives. But that stage is still a while to come. And I ask for your endurance, your support, your patience. Lots of efforts are going on across the world to find new therapies, to find vaccines. Everybody is pushing very hard in this direction. So we need to stay firm and continue trying. We need really unprecedented levels of caution and to continue carrying out the preventive measures that we've advised severally on this platform. I'd like to really refocus and re-emphasize 5 of them, and really to ask everyone to support each other. When we talk about hand washing and respiratory etiquette, it sounds very difficult, and to be honest, it is difficult. Right now, I can't get back into my own household without being sent to wash my hands. And this is the reality. I don't rely on myself anymore to carry this out. Everybody knows in my household that they have to see me. So it's kind of supervising me to do the things I ask everyone to do, in recognition that none of us is strong enough to do this all the time. So I'd really ask everyone to find those checks and balances in our own lives, whether it's in our workplace or at home, to make sure that we do the things that we have to do. Physical distancing is very difficult. So we can't rely on ourselves either. So when you're on a queue and you're moving towards an entrance, hold back or ask other people to do the same. So you allow yourself some distance. This is not easy to do, but we all have to hold ourselves accountable for it. Face masks, as you can see, I had to take off mine to speak to you. I'll put it right back on after doing this. So we too have to hold each other accountable to doing this. It's come slowly, but now we have to accept that almost every time we leave our homes, we need to wear those masks. And it's not as if they're not important at home, but at home we're among a family, and any exposure within that family is difficult to control. So at least we keep whatever we have in the family, and when we go out, we prevent ourselves from spreading it. And spreading it you do by when you go out. And we're an outgoing society. We live outdoors, we walk outdoors. So staying at home and thinking about every movement that we make is very important, especially when we feel the need to travel. And I recognize how difficult this is at the moment. Many families I know personally have not been able to bury their dead, have rescheduled their marriages, have rescheduled their baptisms, have rescheduled everything they're doing. So in a way, it feels like life is in suspense, or we have suspended so many of the things that we hold very dear. So I am sure that everyone on this side of the table recognizes the great sacrifice being made by Nigerians. But we only have to encourage each other to continue. Continue till we get to the position where we can relax some of that. But to get to that place, we have to continue in the short term. And finally, we must remember that the most vulnerable people to this disease right now are the elderly in our society and those with some comorbidities. What do we mean by comorbidities? Some other illnesses. We must protect them. And right now, protecting them is if they're living in the village, please leave them there. Support them with whatever financial resources you can by sending them home. But please, now is not the time to encourage travel. Travel is difficult anyway, rightly so. But really, if you have anyone that in your family, in your society, in your church, whatever social congregation you have, these are really the most vulnerable in our society right now to this new disease, and we must protect them as much as possible. So now to conclude, we're all working hard to get to the point where we can relax some of these measures, but we're simply not there yet. So we ask you to join us, continue on this journey with us, amplify the messages that we are giving. There's no amount of risk communication that we can carry out through our different means that can get to every Nigerian. So we need every message sent out to be amplified several times more. We're very happy to have the leadership of the Nigeria Labour Congress here with us today. We really need your support in sharing these messages, encouraging our citizens to stay firm and join us on this journey. We will get to the end of it, but in the short term, we're asking you for some additional sacrifice as we continue to work hard to flatten the curve and see that we ultimately get out of this pandemic altogether. So thank you very much.
Good afternoon, everyone. My name is Mitaire Ikben with the Nigerian Television Authority. Yesterday, the Minister of Health told us that more than 40 health workers have tested positive to coronavirus in the last 2 weeks. For me, this statistics is huge for frontliners with medical training, not to mention other frontliners without medical training like journalists, cleaners, and security personnel. So what is the plan of the government to mitigate the risk, the hazards, and the dangers posed to all frontliners in the COVID-19 fight? And we were just told now that 5,000 workers have full insurance cover. Are journalists involved in this? I want to also ask that we've not had patients in the last few days. We've not had patients who have been discharged for coronavirus. Does it mean that the patients we have now are not responding to treatment? And a Nigerian just sent this now for the DG of the NCDC, that with 1.5% chance of coronavirus spread if everyone wears a mask, a face mask. Does this suggest that if everyone wears a face mask, the lockdown will be lifted? Thank you.
Thank you. We have taken all the questions. They have been directed in the following order to the Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State Health, and WHO. That is in one group. Another group to the Minister of Foreign Affairs, Honorable Minister of State Education, Honorable Minister of State Labor and Employment, to be supported by the NLC President, and finally, the Secretary to Government of the Federation. We shall begin with the Minister of Health.
Some of the questions that came up, I will leave for the Honorable Minister of State and also the NCDC. With regard to the doctors who were dismissed, well, I would say that this is not a time for any doctors to be pulled out of service. We need all at this time. We need nurses, we need laboratory scientists, we need all hands on deck at this time. But the people who were laid off, I think there must have been reasons, administrative reasons, which I do not know about. But again, if the reasons are strong enough, then it's not, they'll probably looked into by the board of the hospital, and we shall be advised accordingly. Now, as for the burial of COVID-19 victims, I'll ask the NCDC to give the details of that one, and also about the decontamination. Now, for the health insurance, the Secretary of Government did say that the Minister of Health will say something about it, but not now, because there are still a few I's to be dotted and T's to be crossed. So the time frame for that will not be today, because the details will come out. But it is definitely something in question. It has gone very far. Just a few more details that need to be put in. And those who tested in Mabushi 40, I think I'll leave that to NCDC to answer. But the question of isolation, any place where you have an isolation center, we have to have a complement of health workers who are monitoring the persons. Some of them have symptoms, and we can call them patients. Others who have those symptoms are in fact probably not even call them patients, they are just on observation. But they need to be monitored, they need to be looked after. So,
Team said
94.1 FM.
Team said 94.1 FM. Ó ta gbangba yíká ilé yíká oko. Òkè Àbújá la fi kalẹ̀ sí.
Ẹ káàárọ̀, ìròyìn òwúrọ̀ la mú wá fún yín láti ìkànnì Teamsed FM 94.1. Táíwò kékeré ẹkùn lóníròyìn. Ṣáájú ẹ̀gbọ́ kókó tó wà nínú ìròyìn náà. Ìjọba ìpínlẹ̀ Èkó ti ṣe àkọsílẹ̀ 100 èèyàn mìíràn tó lùgbàdì àrùn coronavirus pẹ̀lú bí iye àwọn tó fara káásà àrùn ọ̀hún ṣe gbẹnu sókè sí 1,585 lórílẹ̀‐èdè Nàìjíríà. Àjọ tó ń dènà ìtànkálẹ̀ àrùn àti àìsàn lórílẹ̀‐èdè yìí NCDC sì gbà wọn aláboyún àtàwọn ìyá lọ́mọ níyànjú láti kíyèsára lásìkò yìí. Ìjọba àpapọ̀ ti ṣàlàyé wípé akitiyan lọ lọ́wọ́ láti kó àwọn ọmọ orílẹ̀-èdè Nàìjíríà tó tàn sílẹ̀ òkèrè padà wá sílé. Ìjọba ìpínlẹ̀ Ọ̀yọ́ ti ṣàlàyé pé òun yóò dá 1,000 àpò ìrẹsì tíjọba àpapọ̀ yọ̀ǹda fún ìpínlẹ̀ ọ̀hún padà. Ìgbìmọ̀ tó ń rí sí ọ̀rọ̀ ètò ìdájọ́ ńlẹ̀ yẹn NJC ti pè fún ìfẹ̀yìntì adájọ́ méjì kan ńlẹ̀ yìí tipátipá. Gómìnà ìpínlẹ̀ Ọ̀ṣun ti yan adarí ikọ̀ aláàbò Àmọ̀tẹ́kùn fún ìpínlẹ̀ yìí. Ìròyìn náà rèé lẹ́kùnrẹ́rẹ́. Ìjọba ìpínlẹ̀ Èkó ti ṣe àkọsílẹ̀ 100 èèyàn mìíràn tó fi ara káásà àrùn COVID-19 láàrin wákàtí 24, èyí tí ó gbẹnu sókè jùlọ lórílẹ̀‐èdè Nàìjíríà. Àkọsílẹ̀ tuntun yìí mú kí iye àwọn tó lùgbàdì àrùn ní ìpínlẹ̀ Èkó gbẹnu sókè sí 4,000